Imagine your brain as a bustling city, powered by a network of roads and highways that transport vital supplies. These roads represent blood vessels, carrying oxygen-rich blood to every corner of your brain. Now, picture a sudden traffic jam, blocking the flow and starving parts of the city. This is what happens during a stroke, a medical emergency where blood flow to the brain is disrupted. Strokes occur when a blood vessel in the brain either gets blocked or bursts. This interruption in blood supply means brain cells are deprived of oxygen and nutrients, leading to damage. Just like in our city analogy, if the blockage isn't cleared quickly, parts of the city, or in this case, parts of the brain, can suffer permanent damage. This damage can lead to a wide range of disabilities, affecting movement, speech, memory, and other essential functions. The severity of a stroke depends on the location and extent of the blockage or bleed. A small blockage might cause temporary weakness in a limb, while a large blockage can lead to paralysis or even death. The good news is that prompt medical attention can significantly improve outcomes and reduce the risk of long-term complications. By understanding what a stroke is and how to recognize its signs, we can empower ourselves and our loved ones to act fast and potentially save lives. Strokes, while sharing a common enemy in disrupted blood flow, can manifest in two distinct forms, ischemic and hemorrhagic. Understanding the difference between these two types is crucial for proper treatment and recovery. Ischemic strokes, the more common culprit, occur when a blood vessel supplying the brain becomes blocked. Imagine a clogged pipe preventing water from reaching its destination. That's essentially what happens in an ischemic stroke. The blockage is often caused by a blood clot, a clump of blood cells that forms within a blood vessel and obstructs blood flow. These clots can originate in the brain itself or travel from other parts of the body, like the heart. Hemorrhagic strokes, on the other hand, result from a weakened blood vessel rupturing and bleeding into the brain. This rupture can be caused by uncontrolled high blood pressure, an aneurysm, a weakened and bulging blood vessel, or other underlying conditions. Think of it like a burst pipe flooding a room. The bleeding from a hemorrhagic stroke puts pressure on the surrounding brain tissue, causing damage. While both types of stroke are serious and require immediate medical attention, the treatment approaches differ. Understanding the specific type of stroke is essential for healthcare providers to determine the most effective course of action, whether it involves clot-busting medications for ischemic strokes or surgery to control bleeding in hemorrhagic strokes. Knowing the enemy is the first step in winning any battle. In the case of stroke, recognizing the warning signs and understanding the risk factors can be the difference between a timely intervention and a potentially devastating outcome. Stroke symptoms typically appear suddenly and without warning. One of the most noticeable signs is facial drooping, where one side of the face may appear numb or weak, causing an uneven smile. Arm weakness or numbness on one side of the body is another common symptom. Speech difficulties, such as slurred speech or difficulty finding the right words, can also indicate a stroke. While stroke can affect anyone at any age, certain risk factors increase the likelihood of experiencing one. High blood pressure, high cholesterol and diabetes are major contributors, often referred to as silent killers because they may not present noticeable symptoms until a serious event like a stroke occurs. Smoking, obesity, and a family history of stroke also elevate the risk. Being aware of these risk factors empowers us to take proactive steps towards prevention. By adopting a healthy lifestyle, managing existing medical conditions and seeking regular medical checkups, we can significantly reduce our chances of encountering this formidable foe. Section 4, Time is Brain, the fast response. In the battle against stroke, time is of the essence. Every minute counts as brain cells are deprived of oxygen and nutrients with each passing moment. The FAST acronym serves as a powerful tool for recognizing the signs of a stroke and responding swiftly. Stands for ask the person to smile. Does one side of their face droop or appear uneven? Stands for ask the person to raise both arms. Does one arm drift downwards or feel weak? Stands for ask the person to repeat a simple sentence. Is their speech slurred or difficult to understand? Stands for. If you observe any of these signs, even if they are subtle or temporary, do not hesitate to call emergency services immediately. Remember, time is brain. The faster a stroke is recognized and treated, the better the chances of minimizing brain damage and maximizing recovery. By familiarizing ourselves with the FAST acronym, we can make a real difference in the fight against stroke. Section 5, Winning the War Stroke Prevention Strategies. Section 6, A Future Free from Fear, Hope and Continued Progress.